Compared to working back in Newcastle in the NHS, the work here is more challenging in many ways. The resources that we have are more limited, the availability of resupply is limited, the equipment that we use has to be more robust and is therefore more basic equipment, and the patient mix is completely different. I've seen more trauma here in a few weeks than in 15 or 16 years in the UK, and that's actually very, very fulfilling professionally and very challenging, and certainly a world away from what I do at home. Young 18 to 25-year-old soldiers are living in very difficult, demanding conditions. They're doing really difficult, demanding jobs and dangerous jobs. Some of them are getting hurt, some of them are being killed, and it's important that they have good medical backup. And I'm honoured that I'm considered good enough to be out here providing care for them. We started filming at about 5:15, 5:30.
Don't visual references at all. No idea where we are, how high off the ground we are. There you go, we're on the ground.
And we were called out to an unconscious soldier in one of the forward operating bases. He looked as if he had been having some sort of epileptic seizure or some kind of brain problem. And just as we were handing over his care to the hospital team, we got another call to say that there were 5 casualties who'd been caught in an ambush further out from Camp Bastion, probably about 40 or 50 miles away. So we had a fairly speedy turnaround, and it was dark by the time we got out there. But we spent most of the journey preparing all our kit and talking over the plans for how we would load the patients, what we would do, who would do what, and so on. We got down onto the point of wounding site, and it was very, very dusty. I think whenever the guys jumped off the back of the helicopter, they sank up almost to the knees in fine dust that's almost like talcum powder. And you can imagine with 2 twin rotor blades going, the whole thing was just a huge dust storm. So the back of the helicopter was a bit chaotic with dust, no lights, only starlight, lots of noise, a few little LED torches, but obviously you don't want to show very much light if somebody's just been ambushing you. So fairly difficult environment to work in. And we loaded all the casualties in, and we had to actually collapse some of the stretchers down a little bit to get people to fit in properly. Fortunately, of all the patients that we saw, we didn't actually have to do very much for any of them, and we were able to just temporise their treatments. We were able to confirm what had been done, where the bandages were, some IV fluids, reassurance, analgesia, pain relief, that kind of thing, and got them into Camp Bastion, where again the hospital was essentially prepared for all these people all turning up at once with traumatic injuries. And what we've done is we've handed over the care and given a brief history and summary of what our treatments and examinations were to the hospital staff, who are now looking after these patients. And we've come down to replenish all the kit that we've used over the last couple of hours. So that's one of the important things, that if you don't constantly keep up to date with what your kit is doing and how your supplies are going, then you'll end up going out to a shout without any supply at all, and then you look pretty stupid. So hopefully for the next couple of hours, some of these guys will go to theatre, have gunshot wounds and fragment wounds debrided, cleaned up, and spend the rest of the night in nice clean sheets. And once we've finished here, we're going to go and get a pizza and spend the night in nice clean sheets.